I am Francesca Marie-Babar, BSN 3B RD Group 5, and I will going to perform CPR or cardiopulmonary resuscitation. So what is CPR? CPR is a life-saving technique that maintains blood flow to the brain and to the heart in an emergency situation. So basically, we perform CPR when the person is unresponsive, unconscious, no breathing, and no pulse. So we follow basic steps in performing CPR. These are the doctor's ABCD. D stands for danger, R stands for response, S stands for send for help or shout for help, A stands for airway, B stands for breathing, C stands for CPR, and D stands for defibrillator. First step on doctor's ABCD is danger. Before going to the victim and perform CPR, first we need to survey the scene and check for the danger. We can also ask, why is this victim in trouble? We can check if there is any presence of gas or if this victim is electrocuted. We can check if this victim is drunk or drug affected. Approach with care and do not put yourself in danger. If this victim is on the hazardous area, like on the road, we can move them gently to ensure that the victim is safe and also to ensure our safety. When you are sure that the scene is safe, that's the only time you can kneel in front of the victim or in front of the chest of the victim where you will perform CPR. Next is the response. Before checking the responsiveness of the victim, you need to formally introduce yourself even if the victim is unconscious. Sir, I am Francesca Marie-Babar and I know how to perform CPR. And then gently tap the shoulder of the victim 3 times and gently shout for them. Sir, are you okay? Sir, are you okay? Sir, are you okay? If the victim has no response, this is the time that you need to shout for help or call for help and say that they need to bring AED or ambulance. In checking for the victim's airway, gently tilt the head of the victim and lift the chin. And check if there is any foreign matter or fluid inside the victim's mouth. If there is none, you can check for the victim's breathing. In checking for the breathing, gently tilt the head and lift the chin. And place your cheek on the mouth. And look at the chest if there is any rising and falling. And then listen to the sound of breathing and feel the exhalation. If there is no breathing, you need to check the victim's pulse in the carotid artery. In performing CPR, place the heel of your hand on the lower half of the patient's breastbone and place your other hand on top of it. And interlock your fingers. Make sure that your arms are straight in order to facilitate effective compressions. There must be 30 compressions within 5 cycles, followed by 2 rescue breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 1. To facilitate rescue breathing, gently tilt the head of the patient or victim and lift the chin. Tightly close the nostrils and seal the patient's mouth by your mouth in order to provide air and see if the chest is rising and falling upon facilitating or providing rescue breathing. When you notice that the victim breathes again, put the victim on the recovery position. By putting his hand on the side, and putting this or his right hand on his cheek, and crossing his leg on the other leg towards you. Continue performing CPR until AED or automated external defibrillator is turned on and pods are attached. When to stop performing CPR? You stop performing CPR if the patient or the victim breathes normally again. When the ambulance arrives and when you feel exhausted upon doing the cardiopulmonary resuscitation.